Hi, James. Good morning. How are you today?
Not tired.
Yeah, no. It might look like a simple job, like, oh, what does carer do? But it involves a lot. You have to be physically healthy, emotionally healthy too, because when you go in there, you might be the only contact they have every day. Have you had anything to eat?
Not yet.
Not yet. One thing I always have at the back of my mind is the people we care for, they are not sick. They only grew old.
Amina has been caring for Dundee's elderly since 2022. She works for Call-In Home Care, a service that helps people to live independently.
So here we go. Here are your tablets, a cup of tea, and a glass of water. Do you want some paracetamol this morning?
No.
You're fine. Okay.
James is one of the many clients Amina will see in a day. She prepares his medication, showers him, and ensures his flat is in order. Put simply, Amina is helping James with whatever he needs or can't do himself. Do you enjoy the visits from Amina?
Oh, anybody comes in. I'm nice she's coming in, it cheers you up a bit.
Amina, like most of her colleagues, walks to each of her clients' homes. So, Amina, it's 9:30 just now, already on our way to see your third client of the day. How busy a day have you got ahead of you?
Well, for my morning visits, I still have about 4 left and just 3 lunch visits before I go for my break.
So you take a short break and then you come back, and then when do you work till in the evening?
Yeah, I resume at 4 o'clock. I take a break at 2 p.m., I get a 2 hours break, and I come back at 4 p.m. till 10 p.m.
Till 10 p.m, that's a long day.
Yeah, it's a long day. It's a 13-hour work day, yeah.
And how many people will you see on average in one day?
On the average, on a good day, maybe 16. Then if there's a lot to do, like maybe I have more clients on a day, it might be 18 or 19.
Wow, that's a lot of people needing your care, yeah. Amina's pay recently went up to £12 an hour, in line with the real living wage.
I appreciate it, but things are getting expensive every day, so we didn't even feel the difference. I went shopping immediately and I had virtually the same thing I would have left if I had gone shopping before.
Amina is paid very little for the time it takes for her to walk from one client's home to another, sometimes just £8 for 4 days of work.
They don't get paid very well. Their job is very important. When you're on your own, somebody coming in is really good. You look forward to them coming in. And
How difficult would it be if you didn't have them?
I don't think you'd really manage.
Having someone like Amina around means Moira is less likely to rely on the NHS. It's a service that takes pressure off the system, but it's in demand.
So I hope you enjoy the rest of your day.
I shall.
Yeah.
I'm sure I'll see you again.
Yeah, very soon.
Yeah.
Take care. Bye.
Okay, thank you very much.
Thank you. Bye.
Bye.
Hello, Colin Home Care, Lindsay speaking. How can I help?
And there's thousands of people at the minute waiting for a care assessment for care at home. Why is that list so long in your view?
The complexity of people for care at home now is more than it ever used to be. If I look back to when I first started in care, it was, that typical what people perceive care at home, toasting tea, a chat, and more of the social aspect of it, where people's medical needs, physicals as well, have become a lot more within the community.
Lindsay is campaigning for her team's pay to be bumped up to £15 an hour.
I have family members that work within health and social care. I also have people who work within the childcare industry as well as family members. And I see that the inequality and the value that I feel there is there within pay for the tasks that we do out there helping those vulnerable people.
Is it possible to deliver care for cheaper than it is just now?
Oh, absolutely not, no. It's absolutely an industry where there is not a high percentage of profit involved in it at all. That is a big misconception. I think it's about the government, local authorities all valuing what people do and that recognition and making that equal across the board. Ladies, would you like a tea or coffee?
From Dundee to Dunfermline, the same pressures are weighing on staff. Tyrone is a carer at Abbotsford Care's Headwell House, which is home to more than 50 residents.
Hello, George. Are you all right?
After coming here on school work placement, Tyrone decided to stay. He's incredibly passionate about what he does, but 6 years into the job, the pay has barely increased.
When I first started from school, I originally got £9 an hour, and I think I maybe was 15, 16, so that was fantastic for my age at the time. I'm almost 21 and we've just went up to £12 an hour. So NHS, they're paying per hourly a lot more than what private sector do. They're offering anything from the £13 mark to the £15 mark. Same as local authority, their figures are getting higher and higher and higher, whereas we're staying the same and we're just going up very, very gradual. So a lot of our care staff are maybe here for 6 months to a year, they then leave and then they go to NHS.
What impact does that have on staff morale?
Staff morale can go quite low, especially when that happens, because we all develop friendships and all of the staff speak to each other. But the hardest part is when someone you work with quite well leaves for better money, and then everyone's kind of flat for a couple of days, and then we get new starts, and then our hopes go up, and then eventually another staff member leaves. So it's a really vicious cycle.
After Brexit, many providers like Abbotsford have looked further afield for staff, but now doing so has become much more difficult. Back in March, new visa rules came into force, meaning international care workers could now no longer bring their partners or family members with them to the UK. The Home Office says it's to drive down migration, as last year around 100,000 new visas were approved for care workers, whereas 120 new visas were approved for their dependents. And already it's having a huge impact on staff here.
You make sure you eat all of them for me.
Juliana is one of Abbotsford's senior carers. She moved here from Nigeria with her husband and children and counts her family as one of the lucky ones. Their visas were sorted before the changes, but she says the new rules are a step in the wrong direction. You think not only will it stop people coming to the UK to work in the care industry, that it might actually send people away?
It will absolutely put a stop to it because, well, if I am not an immigration officer, but if you check the number of people that were here last year and the number of people in here this year, I think it has totally gone down. So they are just looking for another opportunity.
It must be hard for you to see friends that you've made here then leave because of either visa changes or pay. Yeah. I mean, how difficult is that? Very difficult.
Because, I mean, like me, I like making friends, right? I call them my family, they're like my family, so, and then maybe tomorrow because of visa and I'm away, I'll be like, nah, it'll be too hard.
Does it make your friends feel unwelcome?
Yeah. I'm sorry, I'm feeling
No, it's
bad
okay.
with this, yeah.
I can tell you feel strongly about this, yeah. It's estimated around 10,000 care workers are leaving the sector every year in Scotland. Juliana is concerned that's only set to get worse. Many of her friends who work in care and were hoping to have their families join them are now faced with two options: leave to be with them or stay here alone. Are you sad for people maybe at home or elsewhere that won't now get the opportunity that you've had?
Yeah.
What needs to change?
I would say if it is possible, right, if that should be reversed, right, because it's just a horrible feeling. Yeah.
The Home Office declined our request for interview, but told us care workers make a vital contribution to society, but immigration is not the long-term answer to our social care needs. Care workers on a health and care visa can apply to extend their stay, change employers and settle in the UK. Those in the route before the 11th of March can continue to bring and be accompanied by their dependents.
I think actually the rules that have changed recently are really enabling short-termism. They're only about getting people over, filling a short-term gap, and not about the long-term sustainability of people moving to this country, living in this country and embedding themselves in the community.
Do you like a word search, Betty? Oh. Yeah?
Social care is close to Alison's heart and it's a family affair. Her parents started the business in the 1980s.
What does the future of social care look like then if no changes are made?
I think if no changes are made, we're going to lose local providers, we're going to lose local provision, we're going to move away from small one-off single home operators and push down to corporate market, which is going to be overrun by private equity companies. We'll lose that sense of community if we're not careful, if we don't invest in the sustainability of these businesses.
There's a bit of a postcode lottery of care around Scotland, across Scotland. Scottish Government say a national care service would change that and make sure everybody gets exactly what they need and it's fair and equal. But we know this has been delayed, it's been massively over budget. Do you think that's the best solution?
I'm just not sure right now that a national care service is the answer because I don't know what it means. Everybody feels a wee bit left out of the picture, and actually the more we're not involved and the more that people are kind of pushed out from the conversation means that we're not going to get the results that the sector needs practically to be able to implement the changes that need to happen.
The legislation has been described as the biggest public sector reform since devolution and aims to simplify how social care is delivered. But Alison says the Scottish Government needs to be more focused on the issues that are at hand right now.
I've been speaking to you for the best part of 4 years now about all these challenges in social care. Do you feel like much has changed in that time? Has anyone been listening?
There hasn't been much change. We're still feeling like we are battling. These are issues that need to be addressed across the sector to make sure we're supporting people all over Scotland and really giving them the care that they deserve.